Which anticoagulant is most appropriate for a plasma potassium test? A. EDTA. B. Heparin. C. Sodium citrate. D. Potassium oxalate. Answer B. Heparin is preferred for plasma potassium measurement because it prevents clotting without binding potassium, unlike EDTA or potassium oxalate, which can falsely elevate or lower results. In urinalysis, the presence of nitrites indicates A. Proteinuria. B. Bacterial infection. C. Hematuria. D. Ketosis. Answer B. Many gram-negative bacteria reduce urinary nitrates to nitrites, so nitrite positivity is a key marker for urinary tract infection. Which microscope objective is typically used for oil immersion? A. 4x. B. 10x. C. 40x. D. 100x. Answer D. The 100x objective is used with immersion oil to enhance resolution by reducing light refraction, essential for examining bacteria or small cellular details. Which of the following is a common pre-analytical error? A. Hemolyzed sample. B. Misinterpreted result. C. Incorrect data entry. D. Equipment malfunction. Answer A. Pre-analytical errors occur before analysis, such as hemolysis due to improper venipuncture, affecting test accuracy. The most appropriate specimen for a blood culture in suspected sepsis is A. Serum. B. Whole blood in aerobic and anaerobic bottles. C. Plasma only. D. EDTA tube. Answer B. Blood cultures require collection in both aerobic and anaerobic bottles to maximize pathogen recovery in suspected systemic infections. Which quality control material is used to validate hematology analyzers? A. Reagent blank. B. Control blood sample with known values. C. Distilled water. D. Patient sample. Answer B. Known control samples are analyzed to ensure the analyzer produces accurate results, detecting drift or malfunction. The main function of a centrifuge brake is A. To accelerate separation. B. To decelerate the rotor safely. C. To mix samples. D. To maintain temperature. Answer B. The brake slows the rotor gently to prevent sample disturbance or tube breakage. Stopping too quickly can resuspend sediment or cause hemolysis. In microbiology, which medium is selective for gram-negative bacteria? A. Blood agar. B. McConkey agar. C. Chocolate agar. D. Mannitol salt agar. Answer B. McConkey agar contains bile salts and crystal violet, inhibiting gram-positive bacteria and allowing selective growth of gram-negative organisms. The most accurate method for hemoglobin measurement in a lab is A. Cyanmethemoglobin method. B. Solly's method. C. Visual comparison. D. Hematocrit calculation. Answer A. The cyanmethemoglobin method provides precise and standardized hemoglobin quantification, unlike older visual methods which are less accurate. Which type of white blood cell increases in viral infections? A. Neutrophils. B. Eosinophils. C. Lymphocytes. D. Basophils. Answer C. Lymphocytes increase in response to viral infections as part of the adaptive immune response, while neutrophils typically rise in bacterial infections. A lipemic sample primarily interferes with A. Hematology tests. B. Spectrophotometric assays. C. Coagulation assays. D. Culture media. Answer B. Lipemia, caused by high triglycerides, scatters light and interferes with spectrophotometric readings, potentially causing falsely high or low results. Which blood tube is preferred for coagulation studies? A. Red top. B. Lavender top. C. Light blue top. D. Green top. Answer: C. Light blue top tubes contain sodium citrate, which chelates calcium and preserves coagulation factors, ensuring accurate clotting tests like PT and APTT. A gram-positive coccus growing in clusters is most likely: A. Streptococcus. B. Staphylococcus. C. Enterococcus. D. Bacillus. Answer: B. Staphylococcus species form grape-like clusters, while Streptococcus typically grows in chains, aiding in preliminary identification. Which analyte is most sensitive to hemolysis? A. Sodium. B. Potassium. C. Bicarbonate. D. Glucose. Answer: B. Potassium is predominantly intracellular. Hemolysis releases it into serum or plasma, falsely elevating measured levels. In urinalysis, which crystal is most commonly seen in acidic urine? A. Calcium phosphate. B. Uric acid. C. Struvite. D. Cysteine. Answer: B. Uric acid crystals form in acidic urine and are associated with conditions like gout. Alkaline urine favors calcium phosphate and struvite. Which instrument measures electrolyte concentration using ion-selective electrodes? A. Spectrophotometer. B. Hematology analyzer. C. ISE analyzer. D. Osmometer. Answer: C. Ion-selective electrodes, ISE, directly measure ions like sodium, potassium, and chloride in blood or plasma with high specificity. A patient's sample is grossly icteric. Which analyte may be falsely elevated? A. Albumin. B. Bilirubin. C. Creatinine. D. Glucose. Answer: B. Icterus, high bilirubin, can interfere with colorimetric assays, potentially producing falsely elevated results, especially in enzymatic reactions. What is the best method to prevent cross-contamination in microbiology? A. Using a single loop for multiple samples. B. Flame sterilizing the loop between streaks. C. Refrigerating plates before inoculation. D. Sealing plates in foil. Answer: B. Flame sterilization of inoculating loops between streaks prevents transfer of organisms, ensuring accurate culture isolation. The main purpose of a quality assurance (QA) program in the lab is: A. To speed up testing. B. To ensure accuracy, reliability, and patient safety. C. To reduce the number of samples. D. To limit staff workload. Answer: B. QA encompasses procedures, policies, and monitoring to maintain high-quality lab results and minimize errors. Which type of bilirubin predominates in hemolytic jaundice? A. Direct, conjugated, bilirubin. B. Indirect, unconjugated, bilirubin. C. Delta bilirubin. D. Biliverdin. Answer: B. Hemolysis increases the breakdown of red blood cells, producing unconjugated bilirubin, which accumulates in the blood before hepatic conjugation.